A very good morning, everyone, and good afternoon to few. Uh, my name is Bilal Qureshi, and I welcome you all today. Thank you for joining us for a very interesting session. Hopefully, it's going to be, which has a title which is of interest to all. It's basically on innovating during crisis, COVID-19, and digital health in developing countries. Without any further delay, I would like to request Max who is going to moderate today, and I would like to introduce him. His name is Max Kriveler. He's head of mobile for development at GSMA, and he will be the moderator for today's session. Thank you very much, Max. Over to you.
Oh, thank you very much, Bilal, for the opportunity. Good morning, good afternoon, everyone. I see quite a few names from a few geographies. Thank you very much, everyone, for joining. There's no doubt that this pandemic has taken all of us by surprise. No one was really prepared for something of this magnitude, and our health systems, whether we're in Milan, in London, in Karachi, are definitely were not dimensioned to manage such a sudden and exponential growth in terms of numbers of patients. So we're all doing our best. We all learn new words and new rules like social distancing, which is much easier for some than others. And everybody's somehow chipping in. Obviously, the governments are doing a lot, large corporations, international organizations, donors, citizens, and in particular, health workers. But when it comes to innovating, being agile in this kind of setup, you ask yourself, like, who best than a startup, really, to have a go at it? And today, we've got the honor of having three entrepreneurs from three digital healthcare startups to join us and discuss what's happened in the past 2 months and what's happened in the next 6, 12, 18 months to come. So we've got Dr. Ariel Awansu from Kia Medicals, who's joining us from Cotonou in Benin. We've got Dr. Ifat Zafaraga from Seat Kahani, who is joining us from Karachi in Pakistan. And we have Hesh Fernando from ODOC, who's joining from Colombo in Sri Lanka. The three startups were part of our Ecosystem Accelerator Innovation Fund, which is a fund that's supported by the Department for International Development in the UK and the Department for Foreign Affairs and Trade in Australia. And they've received funding, mentoring, and technical assistance from the GSMA in 2018 and 2019. Just before we start, this session is also yours. There is, for those of you who are connected on the laptop in particular, there's a Q&A section. I encourage you to post your question there and vote for other people's question, and we'll try and make the most of that digital event, and I'll try and use the questions at the end or as we go through the conversation. And just before we start, let's all hope that we don't have any technical issues and that we can spend these 60 minutes together. So welcome, Ariel, Ifat, Hesh. Thank you very much for joining us. The first question will be an easy one. If you could just introduce yourself and your startups quickly in about 60 seconds, so people know where you come from and what your core business is. I'll start with Ifat.
Hello, everybody. My name is Dr. Ifat Zafar. I'm based in Pakistan, Karachi, and I'm the co-founder and COO of a health tech social enterprise named Sehat Kahani, which essentially means story of health in Urdu. And what it does, we'll talk about it further.
Thank you very much. Ariel, do you want to go?
Yes. Hi, everyone. My name is Dr. Ariel Awansu. I am a medical doctor and the CEO of Kia Medicals. Kia Medicals is a startup which provides digital technology in order to ensure that healthcare services are accessible to everyone. So we are based in Benin, and we provide essentially a platform which interconnects every health institution to ensure that the patient going from one hospital to another can still have the same medical record, so that in any situation, doctor can act very quickly and in a secure manner. I'm very happy to be here, and thank you.
Thank you. Very happy to have you. And now Hesh, ODOC.
Hi everyone, I'm Hesh, the CEO and co-founder of ODOC. ODOC is a Sri Lankan telemedicine company that has operations in India and Sri Lanka as well. Yeah.
Right. Thank you. Thank you very much. Thank you very much. Sorry. Good. So as I was saying, I can only start to imagine how the last 2 months have been for you, and how much you had to rethink what you do, and in particular how you contribute in the context we're in. Can you give us a little bit more details on what you've done during this crisis? Maybe just starting with you, Hesh.
Yes. So in this crisis, early on, the Ministry of Health in Sri Lanka got in touch with us and wanted help setting up the Sri Lankan National Telemedicine Platform, which we were very happy that we managed to set up and get going within a week. And currently, we have over 100 doctors online at any given time, enabling anyone in the country to get a consultation at any time.
I understand you've done something quite similar in Pakistan, Ifa, right?
Yes. So essentially, just Sehat Kahani is a telemedicine platform where we provide access to people, to physicians and female doctors through the digital medium in two distinct verticals. So the first vertical essentially includes creation of e-health clinics or e-health centers in marginalized communities, while the second one is the mobile application. So the interesting thing is that we had launched the mobile application last year officially in November. And I think as the COVID season started, we've had an immense jump in the usage and the consumption. So for example, if you were having 50, 60 consults in a day, it has jumped to having 500, 600 consultations in a day. And I think just like ODOC, we've also partnered with the Pakistan government digital Pakistan initiative. And the idea is that hypertension and so on, and they couldn't reach a doctor. But more importantly, we've been doing COVID screening as well through this app. And based on the national guidelines, through a questionnaire that we've developed, taking inspiration from the government-based questionnaire, what we're doing is that we're screening people who might be suspected for COVID, and then we are referring them to the government authorized institutes. And I think this work has really been taken up and picked up. So that has been challenging yet very exciting as well.
Yeah, I can only imagine. I think we'll go back to the point of how do you manage this kind of growth in the current setting that we're in? I think that's an interesting question to create. And Ariel, in your case, so so ODOC and Sehat Kahani, the core of your business is around telemedicine. With Kia Medical, it's a little bit different. It's around identity and medical identity. So how have you approached the crisis in your case? Can someone unmute Ariel?
Sorry. So I said business is not the telemedicine, it's the universal medical ID solution, which aims to ensure that the patient, whenever he is, they can still have access to the right information to act quickly. So basically, what we did in the past 2 years is to ensure that hospitals are connected to our platform, and the health doctor also are registered on our platform to take care of the patient when he comes with his universal medical ID. The purpose of behind this solution is first ensure that the healthcare services are secure. The second purpose is to reduce the healthcare services expenses, because when the doctor don't have access to the right information, he might come to lose time to take care of the patient. And also, By building this solution, for us, it's a kind of building a foundation to go in maybe 2 years, 3 years to a telemedicine solution, so that maybe a patient, which is in the villages in Africa, for example, can easily have a consultation with doctor in the city, because they will be having a universal medical ID with a medical record behind. So the telemedicine solution were planned from our side in maybe 2 years from here. But with the crisis, we find that it was important to go more quickly and go fast, because the idea from the government were to allow patients to stay at home in order to avoid the spreading of the virus, and also to protect the health workers. And with our background of interconnecting health workers, because currently we have more than 1,700 health workers, medical doctors connected on our platform, and we thought that it will be useful to put this network at the disposal of the population in order to address the crisis. Because the government set up a call center at some moment, which was about 20 people working on 24 hours. But the challenge was that a lot of patients were calling, but the human resources were not that much to cover the demand. So we worked with the help of the Minister of Health in Benin and on a national agency called City, which is in charge of coordinating the different activities we've started up in the country, and facilitate the linking between startup and government, because this one is a bit challenging. So in a couple of weeks, like 4 weeks, we managed to accelerate this deployment, this development. So the technical team worked very hard to adapt the solution so that the telemedicine services can be available for the population. So technically what we did is set up a survey, an online test that can help people to do a personal test of COVID. And when they did the test, we can propose them, if the test is positive, or we have some doubt of infection, we propose them to connect with one doctor of our platform. So the advantage of having this solution is to match the demand with the right number of health workers, and the outcome is to ensure a constant feedback from the health workers to those patients who were very, worried about the health condition.
Yeah, I think we've seen quite a few of these screening solutions, and Ifat was mentioning that Sehat Kahani in Pakistan is doing something similar. I'll go back to the point on the working with the government a bit later, but I think based on what I heard from the three of you, and I see we've got a couple questions in the chat about this as well. I'd like to understand how you touched upon this already, Ariel, but how do you scale up in the current environment? And that could be how do you get more resources? How do you get more staff working with you? How do you onboard more doctors? How do you make sure that things are stable on the IT side? Ifat, you were saying going from 50 to 500 consultations a day. What does it mean?
Yes, so essentially what it meant was, I think when we just jumped into this COVID crisis and this COVID campaign, it essentially meant that in one day we had to recruit around 100 doctors. So, you can imagine, so from the 150, 200 doctors we already had, we had to suddenly recruit 100 more. And it's more like managing an online or a digital or a virtual hospital. I often say this. So it has been crazy. Since the entire globe is taking a lot of financial toll, it becomes very challenging for startups, particularly who are working in health tech, to be able to maintain and sustain the services while being able to perhaps motivate the employees enough. And I think this has been a challenge. So it wasn't just one change that was happening. It was essentially 2 or 3 change that the organization was going through. We all were shifting to a work from home mode. And technically, Pakistan hasn't been a country where work from home has been appreciated much or understood much. So I think this was a major challenge that we initially faced, that everyone had to be shifted to home, and then you're juggling with your household chores, your household responsibilities. Many of us have children, including me, so you have to like manage that also and get dressed to, be a part of Zoom meetings, for example. So I think this was one challenge. But another major challenge that I foresee is having the right financials to be able to sustain and maintain it. So, for example, we have gotten 100 more doctors on the app. Almost 60% of these are on a paid stipend, but the rest we are getting volunteers. I think the positive that has come out of this is that there has been a lot of support from a lot of partners, or GSL partners. There is an understanding by all of them that this is going to take some financial toll. So I think major investors, funders globally are also looking to support it. I understand it's going to take time, but this is something which has changed. I've seen a positive response in terms of that all of them are also willing to innovate quickly and be able to support the COVID crisis. Uh, Hello. Yes.
Yes, can hear you.
Muted. Yeah. But secondly, I think that I found a lot of support from the diaspora-based doctors. So I've gotten in touch of so many doctors who are willing to give back to Pakistan in this time on a voluntary basis. They don't want money, they don't want to be paid. They just want to give back to Pakistan in any way that they can. And I think seeing this enthusiasm by the physicians, there's another initiative that the government has taken, which we have again partnered with. It's called Yarane Watan. And with this initiative, we are inviting physicians, specialists based in the diaspora who are of Pakistani origin to be able to connect back to our platform and give to Pakistan in general. So I think response has been good. So I always believe in the point that whenever there are challenges, ways are also formed somehow out of nowhere. So I think God helps us in this way.
And I think the point on the diaspora is quite interesting. Have you seen like the same thing? Because like there's a very strong diaspora, Sri Lankan diaspora, in particular in the medical world, I understand. So have you seen this kind of support? And also going back to my initial question, like how did it mean for you to just have to find more resources and do more in the current context?
So when COVID hit and we understood that it's going to have large-scale ramifications, we came up with a 9 or 10-point action plan. The first one was around employees and getting everyone to work from home. Being a startup, I guess that was fairly easy for us. And strangely, through the transition, we realized that we are more productive from home for whatever reason it is. And actually, we just took a decision yesterday that when all the restrictions are lifted, we are only going to go to office 1 day a week on a Friday. So it looks like we're going to continue to work from home from now on. The second action was around funding. We were very close to closing a large funding round. Unfortunately for us, there were 2 corporate VCs, and the 2 corporates were really badly impacted by COVID. So they wanted to put the investment on hold. So we had to have had strategies around that, where we got a couple of angel investors, and these were mainly Sri Lankan diaspora that came and gave us some bridge capital in the short term. The third action was around utilization. So our business model before COVID was selling subscriptions to companies, where after they buy the subscription, their employees can do unlimited consultations. We obviously didn't imagine there to be a spike in utilization after COVID. But at the same time, we didn't want to discontinue the service because it was vital at this time. And at the same time, we forecasted for lots of these companies to not be able to pay for a few months' time. So we got hit both on the cost side as well as collection side. So to offset that, we saw a big uptake in the B2C business, which enabled us to control that. Then it came down to renegotiating rents for office space because that was one big outlay, and our landlord was nice enough to give us a big discount on it. Then the next three things were in terms of capacity. One was just ramping up our servers to handle the higher volume that in terms of consultations. Number two was bringing in more doctors, which was fairly easy to do because doctors were now anyway at home since there was a curfew in Sri Lanka. And actually, the hardest thing for us to get right, at least initially, was ramping up the call center agents. And for that, what we did was we contacted another startup in the travel industry who had a call center with no calls coming in. And we were able to second some of their call center employees to us, which obviously helped them retain jobs and helped us also during this period. And finally, it was, okay, what's the new strategy given COVID? And there was a major pivot from us from moving to a B2B company and now predominantly being a B2C company.
Okay. So, yeah, quite a lot of pivoting to do in this context on the resources side, on the financial side. I've heard it from Ifad and I've heard it from you. Obviously, I'm sure that the current crisis has impacted your runway. Ariel, is this the same case for you? And if so, like, do you have any ideas on how to raise money in the current context, or as soon as the heat of the crisis is behind us?
Yes, as you can imagine, the crisis have impacted the runway because technically, with the psychological environment, for the team to get in contact with clients was a bit hard because everyone were upset about getting in contact with people. So the results expected were not that at the end. So what we plan to do is to find a way to reduce every kind of expenses which are not like very urgent or mandatory, so that it can increase our runway and help us to go through the crisis. And the other side, having the opportunity to propose a new solution help us to get some kind of new resources. Because, for example, for the telemedicine solution, for example, the business model in the normal case is to let the patient pay for the consultation and get 20% on the different consultation. But in the COVID situation, the patient don't pay anything because we have some donors who are paying in the place of the patient. And this has been a reality thanks again to City, which set up a task force of different healthcare startups, but also other startups in the ecosystem that can be useful to propose a different solution. And in the other side, they managed to get in contact with different donors like UNFPA, UNICEF, Enabel, and different donors that can help to finance those different startups which have a relevant solution to address the crisis. So this became a new source of return for us that helped us in some case to increase our cash availability. And for the next financing, we are working to find those kind of opportunity because everyone are looking to help, and as soon as you have something to offer, we have the chance to get some new investment. But the idea for us is not to go to VC during this period because the base of negotiation cannot be the right one.
Okay. No, it's interesting to hear that philanthropic capital in that context can come in and help you get an extra few months of runway until you're in a position to raise commercial capital. So that's quite interesting. I'll ask one last question regarding the business, and then I'll move to a couple questions regarding the customers themselves, mine and also some that I see coming up in the Q&A. So there's no doubt that you've pivoted in the past 2 months. Do you have a sense of what happens once the crisis will end? Will you pivot, or basically will the changes that you've made be long-term changes? Maybe starting with you, Hesh.
Okay, so I'm no anthropologist, but I read a great article by Nair Eyal, the author of Homo sapiens, and which he claimed, according to studies and according to history, after big world-changing events, the behavior change that's caused by those events tend to continue after the event has ended as well. So I'm pretty positive that this behavioral change will continue. And in terms of telemedicine, I think we've seen 10 years of change happening in a month. So yeah.
Ifat, you see the changes happening now as long-term changes?
So I feel that there are going to be long-term changes. Also, being from the medical fraternity, I think we will be going through this corona crisis for another year or so. Initially, people were speculating that we'll be stuck like this till September, but there are a lot of researchers which say that there might be resurges happening for the virus. So it's in a way good that companies, businesses, startups have pivoted and shifted to this model, because this enables long-term sustainability. As a company, I personally felt that working from home made us more productive. A lot of time is lost in a lot of unnecessary travel, unnecessary meetings, traveling for longer distances. Has actually enhanced participation. So for example, now, even if we take the example of this session that we are doing, everyone can actually attend it, even if they're based anywhere in the world. So I think these changes are there to stay for a long time. A lot of meetings that we've been doing, a lot of business partnerships that we did, whether be it with government, entities, or corporations, we did all of them while sitting in our homes. And I think everyone understood the unnecessary need to go out, have meetings in person. So I think this is a change which is here to stay.
Okay. So what I'm hearing from you is that, like, the change in behavior, but also the change in the dynamics with the different players in the ecosystem, and also being more productive at home will be long-term changes in your opinion. Cool. I'd like us now to look at the end user, and I got 3 questions. So I'll ask one of you to pick the question you prefer when you answer. So the first one is on, and that's also a question that's coming up in the Q&A, is how do you make this type of services accessible for people who might not have access to a smartphone or not have access to the internet? That's the first question. The second question is, data privacy is critical when it comes to health. How do you make sure that you don't compromise on data privacy as you're moving really fast? And the third one, which was also from the chat, is on impact measurement. How will you go about understanding the impact of what you've done in this time of crisis when things... So I'll start with you, Ariel. You choose either of the questions. So access for people who might not be connected, data privacy, or impact.
Okay, access to people who might not be connected.
Okay, go ahead.
Yeah, so this is a hard question because for the moment, the solution that we are providing is mostly smartphone based, and a unfortunately, people with phone without connection can be excluded. But it's just the first step. Like after this smartphone version, the idea is to ensure that even with USSD, with a mobile operator, for example, the solution can be available for people using smartphone without connection. So today it might be excluding those people, but in the long-term vision, we will make sure to ensure that the solution is more inclusive.
Okay. Hesh, I mean, I'm going to force you to answer the same question because I understand that your solution is also to a large extent smartphone based. So how do you include people who do not own a smartphone today?
We already rolled out the ability for someone to register as well as request a doctor consultation through callback through SMS. So basically, if you want to register, you send something called ODoc to a short code and you get registered. And after that, you just need to say consult and send that to a short code. Then you get an SMS saying Dr. X will call you back in Y minutes and you'll get a call back. Next week, we are going to launch an IVR system where you could do the same process through dialing and speaking to an IVR system. And hopefully in 2 weeks' time, we've signed up with the MNO actually to enable USSD access to the service and for distribution through their platform.
Okay. And Ifat, sorry, we're all covering the same question, but I think it's an important one to make sure that basically the people who might need it the most in the population don't get excluded. And I know it's at the core of what you do with Sehat Kahani. So
yeah, so I think this is a very valid concern, and we had this in mind when we launched the mobile application altogether. Because it's a country with a population of 200 million people, only 75 million smartphone users. So it's not even 50% of the population which has smartphone. So what we did is that we've created a helpline which is backed by a team of nurses and doctors. And the idea is that the nurses can create a triage. So they're provided with an algorithm and a protocol, and patients can then needs to be connected to a doctor or not. So this is something that we've created. We did a pilot. Now we are looking for essentially sponsors who can facilitate us in really taking this up. So this platform has been built and it's there. About your questions pertaining to data privacy and impact measurement. So when we were building this application, it is built HIPAA compliant, and we developed this with one of the leading tech companies in Pakistan, who ensured that all of the data is going to be strongly encrypted, and even me as a startup and as a company founder cannot access it.
Mm-hmm.
So that's, but yes, visiting it. Also on the impact bit, I think that the impact bit is going to be very interesting. Right now we are getting some amazing testimonials by people. So if I just share in terms of stories, so we got a pregnant woman calling in. She had entered labor and this was her first baby, and she did not know that she had entered labor. And she called up our doctor, and our doctor suggested that this is an emergency, she has to rush to a hospital. Then we got 2 corona patients. We got 2 for screening and they turned out to be positive. And they were sent to the hospital timely. And I think I can share tons and tons of stories like that. So not only are we getting a lot of testimonials in terms of how the patients felt that they got something of great value, but also if I talk more in terms of quantitative numbers, so we're also looking at the follow-ups. The follow-up rate is amazing. It's around 25 to 30% at this point. So 30% of the people are calling back again. That is an impact measurement KPI that we for serious ailment, for example, for COVID as well. So right now, these are the 3-4 KPIs that we had.
No, I think it's great, and I think in the heat of the moment, it's good, like, to get these, I would say, qualitative feedback, more anecdotal, and then once you've got a little bit more data, be able to look at like the numbers and just see what the impact will have been and what the long-lasting impact could be. Just to go back on data privacy, I think it's also linked to regulation, and there are a couple of questions here. One is, I mean, we've seen governments around the world play a very strong role, obviously, in the response to the crisis. So how are you working with governments, and who are you working with as well? Because I mean, I'm here in the UK, and I feel like every minister is involved in the crisis. So who's your main point of contact? Is it? I mean, we've heard about Digital Pakistan in Pakistan. There's the Ministry of Health. There's Semicity in Benin. So who are your main points of contact on the government side?
So for us, it was the ICT. Go ahead.
Sorry. I thought it's directed towards me. Sorry.
Go ahead, Ifat.
No. I thought the question was for me completely. Please go ahead.
Hesh, go ahead, and then we'll go to Ariel and then to Ifat.
Okay. So for us, how the process worked was that the ICT agency did evaluation on our application and then gave a recommendation to the Ministry of Health to go ahead with us to implement the National Telemedicine Platform. After they handed us over to the Ministry of Health, it was the Health Information Unit. We had a single point of contact, and it was extremely efficient and streamlined process in order to get this going.
Okay. So ICT.
So that
ICT. Sorry. Ministry of.
Sorry, it was actually the COVID Special Task Force who asked the ICTA, who then recommended us to the MOH. So yeah.
Okay. And Ariel in Benin, so we've heard Semicity, we've heard the Ministry of Health, other players on the government side.
Yes. So when the crisis first came in Benin, the government were a bit overwhelming by action to take. So Semicity take the leadership to mobilize the different startups in order to be a help for the Minister of Health. So they identify the relevant solutions that have been proposed to the Minister of Health. So after Semicity, we have been put in contact with the Direction of Digital Solution at the Minister of Health, which is the leadership position to lead the different solutions.
Mm-hmm.
So Semicity and then the Direction of the Digital Services of the Minister of Health.
Okay. And in Pakistan, Ifat? Okay, I think Ifat froze, so we'll move to the next question. Oh no, go ahead.
Yes, so sorry, I think we're having bad internet days. So we are in conversation with the Digital Pakistan. So one bit is that we're also partnering with the Ministry of Health. That's another division. Unfortunately, in Pakistan, since the federal and provincial governments work separately, we're also trying to reach out to all the different provincial governments also to see how this can be further scaled up with the divisions.
Okay, good, thank you. We've got about 20 minutes left, so I still have quite a few questions on my list, but I'll start turning to the Q&A because some of them are quite interesting. I see one on so there's this situation of Akanksha calls it reinvention of the wheel, but to put it in a more positive way, I would say that there are a lot of similar solutions coming up in a lot of environments like telemedicine and so on. And I mean, from an IT point of view, they look quite similar, even though the way they interact with users or the way they get doctors on board and so on might be quite different. But why do you think that today, like, each country is kind of recreating its own solution or its own set of solutions rather than a more standardized solution that would be applied across multiple markets? Is it because of the specificities of the regulation? Is it because of what the government is mandating? What are the key reasons for you? Just to rephrase the question is why do you think there's in each market 3 to 5 startups working on telemedicine, for instance, rather than like 3 at a global level who will have solutions that apply across 20, 30, 40 markets?
I think there's a lot to do with, in many countries which are highly regulated, it has to come from the government. For example, if I talk about the UK market or the US market, in UK particularly, NHS governs which telemedicine companies are even authorized to practice there. So you need to have kind of like a license from them. So this is one countries which are not that countries hold. I think data is one point which every country holds very dear to. So I think there are a lot of legislations and a lot of trust factors associated with data. So no one would essentially want all of their data to be gathered by another country's platform. Having said that, we have been in conversation with three, I would say, countries where they are interested in having a white labeled version of our application. But then again, it would be something that they managing at an end. And I think that gives them more control and more trust. So they feel that this is something that they can do. Yeah. So I think these are the 2 key factors I see.
Yeah, it's a very valid point. And just to everyone, Ifat's got background in studying e-health policy and so on. So I'm not surprised to hear.
Yes.
I think there are localizations that are required for every country, and the localization is much more prevalent for a health app rather than just a ride-sharing app. But having said that, I don't think it's impossible. So we are currently in India and the Maldives, and if it wasn't for COVID, we would have been in another 2 other countries before the end of this year. If you have a local team who can handle the regulations, can do the changes to the apps that are required, I think there could definitely be at least regional players when it comes to telemedicine.
Okay. Ariel?
Yeah, from my point of view, I think it's something to what my colleague just said. I think from the past years, governments are more aware about the fact to be in control of the local data, and they are a bit worried about hosting out of the country. And in this emergency situation, I think as they don't have, usually government used to have like years of planning and make sure that everything is okay, but in a very short time, like when we have now, it's important for them to be more close to the solution so that they can act more quickly in any situation. And having the providers remote can get things more harder when it gets to come to have some technical adjustment. So prioritizing a local solution is very important for them. And the other important thing is that after the health crisis, they were aware of the socio-economic impact of this crisis, and the the vision for them is also to empower small startup, small solution working on the ground, so that after this crisis, they can still be alive. And it's a way for them to invest in the local economy, I think.
Yeah, I think we heard a blend of reasons here. There's the trust of the government, there's understanding the local regulation, there's building locally, which has a lot of value, and there's I would probably add there's also the trust of customers, who will, with their health, probably trust a local company run by locals and homegrown compared to the general move towards distrust of global companies that can be a little bit more opaque and not always comply with certain rules. So I think that's a good blend here of reasons why we need these services. There's a question from Nick on monetization, and it's always a tricky one when we're talking about health, and in particular if you want to reach a larger part of the population, those people who might have less available income to spend on health. As you're pivoting, what are you changing your model in terms of how you will monetize, and what's your revenue blend going to be? I think Hesh, maybe you can start, because you mentioned that you changed from mostly B2B to now like B2C as a different model.
So before COVID, 95% of our business was B2B. Just to iterate again, that's where we sell subscriptions to companies where they buy subscriptions on behalf of their employees, and then the employees have free access to unlimited consultations on the platform. And the B2C model was where retail customers would come on the platform and pay on a per consultation basis. Just for last month, that split has changed to 50-50. And I think next month, or when we end in May, it's going to look 60-40. So we are seeing that shift where we are moving on to the retail customers who are paying per consultation, because companies right now are finding it difficult to even make payroll. So they have other priorities before considering giving health benefits to their employees.
Okay. Ifat, are you seeing a change in how your revenue structure is defined?
Yes. So I think there's a change that we free for the essentially. So from having a completely paid model where people had to subscribe and pay for a consultation or take a package for an annual pool of consultations, now people are getting it free. But I think what has helped is that this has built a good pool of beneficiaries and a good pool of downloads, which we believe will add a lot of value. This is what has happened on the retail front. On the corporate front, actually, the response has actually enhanced. So in my case, there was a lot of inertia I felt when we were reaching out to corporate before the COVID for a telemedicine platform. So they had a lot of queries. And although the pricing has already been subsidized and we have different packages, for example, packages for general physicians, packages for specialists, and packages if you even want to top it up by adding mental health experts. And I think before this crisis, what I was seeing was that companies were not very excited about it. But post-COVID, from having around, I would say, 8 or 9 corporations, we've jumped to having 35 corporations. And all of them are actually interested in getting the mental health component for employees. So I think this is a strategy that has worked for us because of the COVID. What we've done is that if, for example, if there's a company which is only taking the general physician bed and not adding family, not adding specialist or mental health, for corporations also we are proposing that you can have this service free. I think this is also something which has kind of hooked them on, and they're like, okay, now this is for free. How about we also add my mental health to this, or maybe specialist to this? So I think that has helped us build a good mass of corporations.
Okay. So yeah, in the current context, offering the service free to some people, in particular new users, can make a lot of sense because it's the right thing to do, but also from a a customer acquisition point of view, both on the B2B and on the B2C side. Just going back to the question, we have about 5 minutes left. There's one that keeps coming back, and I know we've had this conversation one-on-one in the past, in particular when we were reviewing your models and so on. Is like, how do you vet doctors? How do you make sure that the people who register as doctors are actual doctors and not charlatans or random people?
So for us in Sri Lanka, there is a daily up-to-date website with all the doctors who have been registered along with their registration number. So obviously the first check we do is we check the doctor's ID card against and the registration against that website. So then we know that these are government certified doctors. And after that, then only they start going through the entire vetting process where our chief medical officer actually interviews every single doctor. And what we realized is that when it comes to telemedicine, the most important skill is communication, because you don't have any sort of physical examination, and the soft skills. So those are, I think, the main things that we look for.
Okay.
Essentially, what we do is, So what we do is that there's a central body which is called the Pakistan Medical and Dental Council. They license doctors. What we do is that we confirm all licenses of the doctors that we get on board from PMDC. Apart from that, all of the doctors that we get need to have a minimum experience of 3 years and should not be out of workforce for more than 3 years if, for example, at this current point, they're not practicing. Thirdly, we have developed a very strong training module. So every doctor who comes on board has to go through that rigorous 18-module training process, which enables them to be able to practice primary health through telemedicine. And fourthly, we have created an in-house quality assurance team whose role is essentially, managing how the doctors are being trained, how are conducting the consultations and the sessions. So I think these are 3-4 measures that have really helped us build on the quality of the doctors.
Okay. And is there a similar list or registry in Benin?
Yeah, sure. Our process is quite similar to ODOC process. So this control is what we already used to do with our centralized platform. So basically, everyone can register on our platform as a patient. But then, in order to have access to the doctor interface, you need to submit an application with the different information about your identity, your registration card, also your diploma. So we used to control these different information with the Medical Doctor Association, and they used to have an updated list available on their website. And also we used to work with the Faculty of Medicine. We have 2 in Benin, for example. So each year they used to update the graduate doctors. So even though they are not already registered in the association, they have this diploma. It gives them the legitimacy to work on our platform. So after the checkup, we can give them access to the platform so that they can take care of patients.
Okay, cool. So there seems to be robust systems in every market, which is reassuring. Okay, I've got one last question, which is a bit like looking forward, maybe 5 or 10 years. What do you think is when you look at new technologies coming up, Internet of Things, AI, big data, and so on, do you see a risk of your business being massively disrupted and maybe the doctors that you're currently involving being replaced by robots or AI or bots or algorithms or whatever? Or do you think you still have a good 5, 10, 15, 20 years dealing with things the way we're dealing with them today?
So I think the AI technology is definitely going to augment doctors. I think it's going to be normal for every single doctor to have some sort of AI diagnosis application with them when they do a consultation. And I'm sure the patients also will use AI doctor bots, maybe to do a pre-primary consultation, and then afterwards to get more information, speak to a doctor. I also see that in the next 5 years, especially after COVID, online or remote consultations is going to outnumber physical consultations. I'm very confident of it, just by the trends that we've seen now, and also by knowing that normally the impact of a world-changing event only happens maybe 12 to 24 months afterwards. You see the real impacts of it. I also do feel that there's going to be a sort of a new a smart home thermometer. Right now, there are already products that can enable doctors to get vital signs from patients even while treating them remotely. For example, they can get their heart and lung sounds, they can get their temperature, they can get their the blood pressure, pulse the oxygen saturation. These devices are already out there, and it's just a matter of years before they become the price points of them drop sufficiently to become mass scale affordable. So that's the way I see this space evolving in the next 5 to 10 years.
Ifat, Ariel, are you aligned? Anything to add?
Yeah, I think definitively artificial intelligence, big data will have a great role to play in the future of the health system. But personally, I don't think that those different solutions will replace the human doctor, because the human fact is still important in terms of taking care of the patient, in terms of reassuring the patient, and we will still need, even though we have those AI and big data solution helping doctors, we will still need doctors physically working directly with the patient instead of having algorithm only.
Ifat, last word?
Yeah, so I think I definitely agree to Hash that the online consultations will eventually outnumber physical visits. But having said that, I think it's going to be a mix of AI as well as doctors. I think AI or chatbots might help in triaging or connecting to the right kind of doctors. But I feel in the next at least 5 to 10 years, the ultimate decision maker is going to be the doctor only, and not the robot. But there will be heavy reliability on the diagnostics and the tools and the triaging on artificial intelligence.
Okay. So in summary, the future of health is still human, but strongly assisted by technology. Great. That takes us to the end of the hour. I would like to thank everybody who attended and listened in to the session. I think we peaked at 106 people, which is really good. Also thank the GSMA team, Sam, Bilal, Philip, Laura, Sam, Anna, and I'm probably missing some people here, to make things work, organize everything, and get the tech ready and working, and it worked for 60 minutes, which is pretty amazing. And finally, obviously, thank the three of you, not only for your time and sharing today, but also, and more importantly, for all the work you're doing. I believe you and your team are having very long days these days, but what you're doing is having an impact, and thank you very much for your commitment. For people who joined in and want to hear more, you can head to the GSMA website, and you will actually find video case studies on most of our projects, including the ones we discussed today. And the team will share these on social media as well, if you follow us on Twitter or LinkedIn, for instance. But thank you very much, everyone. Thanks a lot, Hesh, Ifat, and Ariel. It was lovely talking to you again, and I hope we'll get a chance to talk again soon, if not meet in person.
Thank you very much. Yes. Thank you. Bye-bye.
Bye. Thank you.
Thank you so much. Bye-bye.